Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS. Certificate in General Duty Assistance, CGDA. BHT 002 Basic Needs of Patient Care. Block-1 Patient Hygiene. Unit 5 Care of Scalp and Hair. 5.0 Introduction. One of the aspects in maintaining personal hygiene is taking care of the hair. Excessive hair needs to be trimmed and maintained properly, and hair that has fallen off the patient should be cleaned. There are various methods that need to be followed for hair care of a patient. In this unit, you will learn the steps to maintain cleanliness and hygiene of the patient's hair. 5.1 Objectives. At the end of this unit, you will be able to explain significance of cleanliness and hygiene of the patient's hair. Describe hair care and its importance. Discuss common methods of hair care. Describe steps for assisting a patient with hair care. Explain tips for maintaining hair hygiene, and describe prevention and treatment of pediculosis. 5.2 Care of scalp and hair. The head and the face are the predominantly hairy regions of the body. In addition to these areas, hair is present under the armpits, chest, and genital areas of both male and female patients. The outermost layer of skin on the head is called the scalp. Hair cells are embedded in the scalp, and each strand of hair keeps growing during the lifetime of an individual. Different types of bacteria are present on the scalp and the hair. If the hair is not kept clean, it tends to become matty, greasy, and can smell bad. These conditions aid the growth of germs in the hair and lead to infections. You must ensure that the hair is kept clean and excess hair is periodically removed to avoid any discomfort to the patient. The cleanliness and grooming of hair is frequently related to one's sense of well-being. One has to care for the hair in order to keep it clean and healthy. Hair needs light and fresh air. Stimulation of blood circulation by massage and brushing is essential to keep the hair healthy. Illness, worry, grief etc. affects the health of the hair, often by loss of hair. An unclean scalp will allow the growth of microorganisms and parasites on the scalp. Keeping the scalp clean by brushing and shampooing will help to relieve the dandruff. There are 3 aspects of the care of hair. 1. Daily care by brushing and combing. 2. Shampooing the hair in order to maintain its cleanliness. 3. Treatment of hair for infestation such as lice. Let us look at the different methods of maintaining the hygiene of the hair of a patient. 5.3 Principles and purposes for hair care. Following are the principles to be followed during hair care of patient in hospital setting. Patients who can take a shower by themselves should be encouraged to wash their hair regularly. Shampoo is a special agent that can be used to clean the hair. You must motivate patients to shampoo their hair regularly. In case of patients confined to the bed, you must shampoo the hair of the patient and keep the hair of the patient clean. Hair should be properly combed from time to time. You should assist the patient in combing the hair and keeping it clean. In the case of male patients, facial hair in the form of a beard or a mustache has to be shaved and trimmed according to the patient's choice. Excess hair in other regions of the body such as the armpits or the chest has to be removed according to the directions of the doctor. Purposes of hair care: to keep the hair clean and healthy, to promote the growth of hair, to prevent loss of hair, to prevent itching and infection, to prevent accumulation of dirt, dandruff and oils, to prevent tangles, to provide a sense of well-being, to stimulate circulation, to destroy pediculi, to appear well-groomed, to observe the scalp or fungal infection, dandruff. 5.4 Preliminary assessment during hair care. The following should be carried out as a part of the preliminary assessment. Check the physician's and nurse's orders to see the specific precautions for the patient's movement and positioning. Assess the general condition of the patient and their ability for self-care. Assess the condition of scalp and hair. Assess the patient's mental ability to follow directions. Check the articles available in the patient's unit. Daily care by brushing and combing. Articles required: clean towels 1 to protect the shoulders and garments, and 1 to protect the bed clothes. Clean comb with coarse and fine teeth. Coarse teeth is used for removing tangles, and fine teeth for removing nits and for making the hair glossy. Kidney tray with disinfectant solution to disinfect the comb. Oil in a container. Paper bag to collect the loose hair. Daily care by brushing and combing. Preparation of the patient. Caregiver should do following while preparing the patient. Explain the procedure to the patient. Make the patient sit on a bedside chair if possible. Otherwise maintain Fowler's position. Protect your uniform with aprons to prevent the pediculi from sticking to their own dress. Daily care by brushing and combing procedure. The procedure for hair care is as follows. 1. Wash hands. 2. Collect articles and bring them to the bedside. 3. Explain the procedure to the patient. 4. Place the patient in a sitting position if possible, otherwise turn the patient's head to the side. 5. Place one towel over the patient's shoulders if shampooing hair on the bed. Cover the back of the patient with a dry towel if he or she is in a sitting up position, or cover the pillow if he is lying down. Allow the hair to dry completely and then apply oil. Comb the patient's hair. Clean and replace the articles. Wash hands. Record the procedure. Report to nursing officer if you observe any fungus or dandruff on the scalp. Special points to remember. 1. Give the patient a hot drink if necessary. 2. Note the patient's pulse before the procedure in case of very serious patients or patients with heart ailments, and make every effort to prevent from exertion. 5.5 Types of hair care for patient. In following section you will learn about the types of care for hair may be required as per the need of the patient. A. General. A patient's hair should be combed daily. In addition to other care provided to patient, it is necessary to enhance morale, stimulate circulation of the scalp, and prevent tangled, matted hair. B. Daily care. Encourage the patient to rub his scalp with fingertips to stimulate circulation. This can be done by the relatives of patient also. Comb hair in a suitable style which patient wants. Assist a patient to comb matted and tangled hair. First comb the ends and progress toward the scalp. Hold the lock of hair being combed between the scalp and the comb to avoid pulling. Brush the hair as necessary. C. Hair cutting. Barber service is provided in most service hospitals. The barber makes regular rounds on the ward or comes by appointment. The patient receiving the service pays the fee directly to the barber. Ambulatory patients go to the barber shop or beauty parlor if the medical officer approves. Hair is cut and shaved by barbers. Barbers can provide hair cutting services in the hospital as and when requested. D. Shampoo. The patient confined to bed will require a cleansing shampoo at least every 2 weeks. With the approval of the medical officer, plan the shampoo for a time when the patient feels comfortable and has no conflicting treatments or appointments. If the patient can be moved to a stretcher, do so and take him to a convenient sink. If this is not possible, do the shampoo in bed. Principles for shampooing the bedridden patient's hair. The supine position is preferred for weaker patients. Patients with significant heart or lung disease will not tolerate being supine, they must be in a sitting position. Hair care should be given regularly during illness, just as it would be normally. 5.6 Assisting a patient with hair care. You will learn the procedure of hair care in the practical Unit 5. Following section of unit will help you in identifying your role in assisting to patient with hair care. Arrange for all the required equipment by the side of the bed before you start cleaning the hair of the patient. Hair should be shampooed 2 to 3 times a week as it becomes dirty or greasy soon. However, before washing the hair of the patient, check with the doctor if it is fine to use a shampoo. Gently dry the hair of the patient using a clean dry towel. Now, help the patient comb the hair with a comb or a brush. Provide the patient with towels and sheets for cleaning immediately after the procedure. Tips for maintaining hair hygiene. If the hair is wet, do not dry the hair fully with a hair dryer. Let it dry naturally. If possible, combing the hair prevents it from getting entangled. Use short tooth combs for short hair and large tooth combs for curly hair. To untangle hair, use a wide-toothed comb, starting from the ends. When all tangled ends have been removed, comb the hair from root to end. Parting allows for ease in brushing smaller sections of hair. First, part the hair into 2 sections and then separate each section into 2 more sections. Brushing helps to keep the hair clean and distributes the oil evenly along the hair shafts. Do not strain the hair strands by brushing too vigorously. Avoid tying or braiding your patient's hair too tightly. After use, wash the brush and comb in hot soapy water. 5.7 Pediculous IS and its treatment. Due to lack of proper hygiene, parasites can infest hair. The most common infection is pediculosis or lice. They are tiny, grayish-white parasite insects that infest mammals. They are of three types: Pediculosis capitis, head lice; Pediculosis copperus, body lice; Pediculosis pubis, crab lice. Lice can be transferred from person to person through direct or indirect contact. Effects of pediculosis: discomfort, nervousness, restlessness, latching, scratching, infection, abscess, anemia, lymph node enlargement. Spreads typhus fever, relapsing fever, trench fever. Spreads on linen, blanket, bedding, towels, combs, brushes and other articles quickly. In present unit we will be discussing about pediculosis capitis, head lice, in following section. Pediculosis capitis. Pediculosis capitis, also known as head lice, are tiny insects that are found on the human scalp. This problem mainly affects children. Causes of pediculosis capitis. Pediculosis capitis or head lice can easily be caused by active infestation from another person with head lice. The children are mainly affected as they can come in contact while playing or at school. Pediculosis capitis may also be caused by indirect infestation through brushes and combs, hats and scarves, hair accessories, pillows, headphones, upholstery, towels. Symptoms of pediculosis capitis. The symptoms of lice infestation are not visible in the first 2 to 6 weeks, but some of the common signs and symptoms are continuous itching in the scalp, neck and ears, visibility of lice on the scalp, lice eggs on hair shafts. The lice can only be spotted around the ears or near the hairline of the neck. Medical care should be taken immediately if suspected of the above symptoms. Diagnosis of pediculosis capitis. The best way to diagnose an active infestation is by identifying a live nymph or an adult louse. The doctor normally recommends examining the lice in wet hair. On carefully combing the hair using a fine-toothed comb, the lice can be seen. The combing process will be repeated several times until all the lice are removed. Treatments of pediculosis capitis. The doctors usually recommend an over-the-counter (OTC) treatment that is helpful in removing the lice from the scalp. OTC treatment is based on pyrethrin, which is toxic to lice. The doctors will recommend washing the hair with shampoo before taking these treatments. In some cases, if OTC treatments are not successful, the doctors may also recommend one of the following: benzyl alcohol treatment for children above 6 months of age. Malathion, a medicated shampoo for children above 6 years of age. Lindane shampoo treatment. Purpose: we need to apply pediculosis treatment to the patient for the following reasons: to destroy hair lice and to keep hair free from nits, to protect health personnel and other persons from being infested with pediculi. Articles required for pediculosis treatment. You would require a clean tray containing with the following objects: anti-lice agent, either liquid or powder form, e.g. Lysil, Medica, vinegar or DDT powder mixed with oil or powder 1,9. Vaseline, a pair of gloves and a mask, cotton swabs in a container, face towel to protect the eyes, Macintosh with cover, kidney tray with carbolic solution, paper bag, apron, screen. Procedure. The following is the treatment to be followed for pediculosis. 1. Explain the procedure to the patient. 2. Wash hands. 3. Assemble all the articles and take them to the bedside. 4. Screen the patient. 5. Put on the gown and position the patient, preferably in a sitting up position. 6. Place the Macintosh with cover over the patient's shoulders if they are in a sitting up position, or under the head and over the pillow if they are lying down. 7. Cover the patient's eyes with the face towel. 8. Put on the gloves. 9. Apply Vaseline on the skin around the hairline. 10. Apply the anti-lice agent to the hair and scalp, following the prescribed instructions whenever necessary. 11. Cover the hair with a towel or a triangular bandage and leave it on overnight, or for the amount of time prescribed by the anti-lice agent being used. 12. Remove the articles. 13. Clean and disinfect the articles. 14. Wash hands. 15. Record the time, treatment, type of agent used and condition of the patient. 16. Shampoo hair or wash it with soap the next day. 17. Repeat the procedure if required after 1 week. Anti-lice agents which can be used are DDT powder 1:9 ratio. Mixed with oil or powder. Kerosene mixed with sweet oil 1:1. Warm vinegar. Commercial anti-lice agents, e.g. Medicare, Lysol. Special points to remember. Protect yourself and others from an infestation. Repeat the procedure as and when necessary. Instructions to be given to patient. Instruct the patient to avoid touching the hair after application of anti-lice agent. 5.8 Summary. In this unit we have discussed about the patient positions, use of assistive devices, and types of restraints. We have also discussed that how to assist the patient for hair care. In this unit we have explained about the pediculosis, its types, purposes, anti-lice agents used for pediculosis treatment, articles required and steps of procedure for pediculosis treatment. Thank you for watching. We will see you in the next video with the next chapter.